This is a prenatal diagnosis genetic tutorial presented by the SchrDbb, that is Dassi Bopda, with reference ABC Clinical Genetics by Helen Kingston. Here we're going to visualize prenatal diagnosis. So there are different techniques of prenatal diagnosis. We have imaging techniques like ultrasound, which is very safe and performed mainly in second trimester. For visualizing abnormalities, we have amniocentesis. Amniocentesis, a procedure risk is 0.5 to 1.0% of abortion is going to occur. You have performance is second trimester and widely available. Now, chorionic villus sampling is a procedure risk is 1 to 2%. Performance is as from the first trimester and specialized technical use. Chordocentesis is procedure risk is 1%. Performance in the second trimester. And when it's a chordocentesis, it means that what you are sampling material from the umbilical cord of the fetus. Chorovenous sampling is that you are sampling material from the colon of the fetus, and the amniocentesis is that you are sampling the amniotic fluid. Now, fetal tissue biopsy is that you are sampling the fetus tissue, the fetal tissue. So it's a procedure which is less than 3%, performed in second trimester, very specialized technique, limited application. So we have embryo biopsy. So embryo biopsy, limited availability and application. So the indication for prenatal diagnosis. So there are certain cases that are, what are the criteria, the general criteria for prenatal diagnosis, the indication. The first thing is a high genetic risk, provided that you have calculated the risk of patient. Example, you have a mother who is a carrier of an autosomal recessive, and then you have a father also a carrier of autosomal recessive disease. Now, since both of them are carriers of autosomal recessive disease, it means that the probability for them to be carriers is already 1. It's already known that they are carriers of autosomal recessive disease. Now, since they are carriers, the next thing to know is that what is that their children. So what is the probability for them to have one child with an autosomal recessive disorder? The probability for them to have one child with an autosomal recessive disorder is going to be 1/4. One child to be affected is going to be 1/4. So if they have a very high risk of developing a child with a disease. So in this case, with high risk of developing, you have to do prenatal diagnosis. That's the first thing. The second thing, you have severe disorders. If there are severe disorders in the mother, like a severe preeclampsia, severe all these disorders, you can do prenatal diagnosis. Like also with teratogenic factors, you can do prenatal diagnosis. You have treatment not available. If the treatment for that particular disease is not available, or the amniotic lateral sclerosis treatment is not available, you have to do the prenatal diagnosis. If the severe disorder like neurofibromatosis type 1 and type 2, which are genetically inherited, you have to do prenatal diagnosis. Reliable prenatal tests available, and you have acceptable to the parents. So those are the 5 main conditions which can which are the criteria for prenatal diagnosis. So the criteria, the first thing here, it is you can see osteogenesis imperfecta type 2 can be detected by ultrasound in the second trimester. So as you can see here, you see the limbs. These limbs here are not a hyperechogenic, so the hypoechogenic here, so we can tell you that there is osteogenesis imperfecta. A simple way to know osteogenesis imperfecta is that osteogenesis imperfecta is like rickets which occur in children who in fetus. Is it clear? It's a congenital rickets. That's the only way of calming osteogenesis imperfecta, because here they are going to have excessive osteoid tissue, just like in patients with rickets, and they are going to have abnormally enlarged faces, head, and they have very soft malleable bones. That's osteogenesis imperfecta. So the severity of disorder. So these are all the cases. So you have the high risk. If the patient has a very high risk of developing disorder, if the patient have, like in the cases of Down syndrome, when a mother has an age of greater than 35 years, she has to do prenatal diagnosis. If there is severity disorder, several important factors must be carefully considered before prenatal diagnosis, one of which is severity disorder. For many genetic diseases, this is beyond doubt. Some disorder lead to inevitable stillbirth. So when there are certain disorders, you should do the diagnosis. When the treatment is not known, you should do prenatal diagnosis. And test reliability, it has to be reliable. You should not use tests that you are not sure that the outcome is going to be positive or negative. Is it clear? So this now is going to show shortened limb in Noonan syndrome. It's an autosomal recessive lateral skeletal dysplasia. Noonan syndrome. The next one is encephalocele, may represent an isolated neural tube defect on the or be part of multiple malformation syndrome, like as in the Merkel syndrome. So you have dilated loops of the bowel in case of jejunal atresia, indicating the need for neonatal surgery. So this one don't need to be having to be miscarriage medically. No, there is no need for abortion for abortion to occur here. Is it clear? So we have fluorescent in situ hybridization, which can be done with the chromosomes of the child in order to find if there's any genetic abnormality. But here in this case, using chromosome abnormality or chromosome 21 pro enable rapid reliable trisomy 21. As you can see here, they are very yellowish here, so it can tell you that there are 3 chromosome 21 to show you that it is trisomy 21. Now screen testing. So the screening test aim to detect the common abnormality in pregnancy that individual low risk or not. So you need to know that what application of prenatal diagnosis. So there are certain elements in prenatal diagnosis which can be used in order for you to detect certain disorders, like the maternal serum screening level for alpha fetoprotein and estradiol and human chorionic gonadotrophin estimation. So you need to know that when the alpha fetoprotein and estriol and human chorionic gonadotrophin level are very high in the mother during the first and the second trimester, it can make you think of a very high risk of Down syndrome. You have ultrasound can help you in structural abnormalities, amniocentesis. You have alpha fetoprotein also still in the amniotic fluid. You can have acetylcholine. You can have chromosomal analysis, biochemical analysis. When you see alpha fetoprotein inside the amniotic fluid, it means that the child, it is a high level that there is going to be labor soon. When there is alpha fetoprotein present at the level of blood, at the level of amniotic fluid, not at the level of blood of the mother. If there is alpha fetoprotein level of amniotic fluid, it means that the child is going to be labor soon or spontaneous labor soon. If there is maternal serum, alpha fetoprotein is going to be elevated, then there is high risk of Down syndrome. Now, chorionic venous sample, you can do DNA analysis, you can do chromosomal analysis, you can do biochemical analysis. Is it clear? DNA, chromosomal analysis, biochemical analysis. But for amniocentesis, you cannot do DNA analysis. For fetal blood sampling, you can do both DNA analysis, chromosomal analysis. Is it clear? So those are the different screening tests that can be used. Now, what are the methods of prenatal diagnosis? We start first with maternal serum screening. Is it clear? So you can use maternal serum screening to find alpha fetoprotein. You can find the beta human chorionic gonadotropins. You can find the estriol. The levels can be high or the levels can be low. So these are some causes of increased maternal serum of alpha fetoprotein. You have underestimated gestational age. So when the gestational age is thought to be low, you can have underestimated gestational age is alpha fetoprotein are going to be high. You have threatened abortion. because alpha fetoprotein levels is high also when you have when the fetus, when the labor want to start. You have multiple pregnancy, you have fetal abnormalities with high level of alpha fetoproteins like anencephaly, open neural tube defect, Turner syndrome, bowel atresia, skin defect, Down syndrome also have it. You have maternal hereditary persistence of alpha fetoprotein, and you have placental hemangiomas. So those are the things that causes high level of alpha fetoproteins. Now when you add high level of alpha fetoprotein plus beta human gonadotropins plus unconjugated estradiol, it can make you think of a high risk of Down syndrome during the second trimester. Now ultrasonography. So ultrasonography, these are the different methods. It can help you in the first trimester. It can help you to confirm the pregnancy. It can help you to know the gestational age. It can help you to know the viability. It can help you to know the location of the pregnancy, and it can help you to, so those are the different elements. So it can help you also to confirm the pregnancy. So there are 5 main things that the first trimester ultrasound help you to do. So now the disorders like neural tube defect, several severe skeletal dysplasia, abdominal wall defect, renal abnormality may be detected on ultrasound by the second trimester. Is it clear? Now abnormalities may be recognized during routine scanning of the pregnancy. You may see abnormalities like this, which show a cardiac leiomyoma in a tuberous sclerosis patient. Is it clear? Or you may see an abnormality like that with a large lumbosacral meningocele. Is it clear? Now amniocentesis. The procedure of amniocentesis is that a syringe is going to be placed at the level of the umbilical cord, and then it's going to be echo-guided such as the cord should not touch the embryo. So is it clear? So amniocentesis is well established and widely available method which is used at the level of the second trimester from 15 to 16 weeks of gestation. Is it clear? And the risk is 0.5 to 1%. That can be aborted only. And now, what are the different testing methods that can be used on the amniotic fluid? We can do chromosomal analysis with karyotyping. You can do biochemical analysis, but you cannot do DNA analysis. Is it clear? You can also find the level of alpha fetoproteins there. Now, coronary video sampling. Here, you are going to try to sample the chorion. Is it clear? It can be done at by 10 to 12 weeks. That's still in the first trimester. Is it clear? You can do it by that level, and then in this you can do DNA analysis with that. You can do in coronary you can do fetal chromosomal analysis and do biochemical analysis. And now with fetal blood sampling, fetal blood sampling can be obtained directly from the umbilical cord under ultrasound guidance. So you take the blood or you take the tissues of the patient, enable rapid fetal karyotyping, DNA analysis or all that. Now pre-implantation of and genetic diagnosis. So you can do also pre-implantation and genetic diagnosis, which is embryo biopsy. You can do pre-embryo biopsy, now technically feasible. Is it clear? So you do so before you implant a fetus after in vitro fertilization, you can first do a biopsy of that embryo. Is it clear? When you do a biopsy of that embryo, you visualize if the cells are completely normal by still chromosomal abnormality and DNA analysis and biochemical analysis. When you visualize all that, now you can do implantation. So what are the potential application of pre-implantation genetic diagnosis? So when which disease can you use this? You can use in fetal sexing X-linked disorders like Duchenne muscular dystrophy, hemophilia, Hunter syndrome, Merck syndrome. You can use in chromosomal analysis like trisomies 21, 18, and 13. Familial chromosomal rearrangement. I have direct mutation analysis like cystic fibrosis, childhood spinal muscular atrophy, Hutchinson disease, and sickle cell with beta thalassemias. So from here we are finished with this genetic tutorial on pre-implantation and genetic on the prenatal diagnosis of genetic diseases. So from here, we say thanks for your kind attention. Please don't forget to like and subscribe for our channel. Thanks very much.